Okay, and we are live. Hi, everyone. Hello, hello, hello. We are here for another Facebook Live. Come on into the space. Before we get into official introductions, we want you to come in and get settled. So, find your most comfy place on the couch or your favorite spot in your home to join us for this very, very important conversation. We are so excited that you're here. I always like to kind of open up these conversations by expressing that you are one of the most important pieces of this conversation because your presence here is what helps us to change the narrative. So we're so happy that you're spending your Tuesday evening with us. You could be anywhere else in the world. So thank you so much for coming on board. Um, I'm so excited for this conversation, not only as someone who is a professional in the maternal health care space, but also because I am a mama myself. So I recognize that conversations about this subject is so important. Tonight, we're talking about perinatal mood and anxiety disorders, which I know sounds like a really big term, right? But it's really just a way to describe how some of the emotional and mental health challenges that moms experience while pregnant and in the postpartum period. And I know that oftentimes, we're told that the postpartum period is this, we associate happy feelings with pregnancy and postpartum, which is true. Yes, that can be a part of the process, but it's not that simple. It can be a little bit more complex than that, right? We know that motherhood can bring a mix of emotions, right? We know that it can be accompanied with some heavy emotions like sadness, anxiety, and even fear. So we kind of want to explore that tonight because too often we don't associate mental health challenges with pregnancy. Sometimes mamas don't know how or when to reach out for support. And so tonight's conversation is to kind of change the narrative around that, right? And so we're creating a space to talk about it all. And so this is not just a conversation for mama. We envision this as a conversation for partners, for our support persons, for anyone who just wants to ensure that mamas have a thriving pregnancy and a thriving postpartum pregnancy. And we know that the more we normalize these conversations, the more that mamas will feel safe in reaching out for support. So, again, welcome. We hope that y'all are settled. Um, I am really excited about our guest tonight, Dr. Rachel Tyrone. She is someone who is truly at the heart of improving maternal and infant health outcomes in our state, and she brings a very rich perspective that is both clinical based and research based, and she just carries a really deep commitment to wanting to see our mamas thrive and to see the birthing outcomes in our state improve. And so I'm not going to disclose a full report or background on her. I'm going to allow her to kind of introduce herself to us and share a little bit about her background.
Well, thank you so much, Ladune. It is a pleasure to be on here. Thank you for what you do and all of these, just the awareness that you bring to this topic. Um, I'm Rachel Tyrone. So it's going to be interesting on my background for how I kind of come to us today or everybody here. So I am a speech language pathologist by training. So that is what my clinical background is in. I started working almost 10 years ago. So it's crazy to think I've been in the field for 10 years, a whole decade. But I
Wow.
started in the area of pediatric feeding and swallowing, and then later on started moving towards early childhood health and development. I started working on a training program, and it was through that training the child does not live in a silo, that it's a part of a system, it's a part of a whole. And then from there, just I started doing a PhD, a doctoral program in population health sciences, where I learned so much more too about all of the differences in health and how there's different populations that may have different health. And so I've really been able to expand my not only clinical knowledge, but also understanding from a research perspective some of these differences in health. And I came into the maternal mental health space because you can't take a little child away from its mother. And so earlier on, as I mentioned in my career, I was understanding that there's this relationship, there's this back and forth that plays a big factor in what we see and with development. But then I became to get even more into the maternal mental health space whenever I was able to come on working on a grant that we have where we're only focusing on maternal mental health and substance use disorders.
Mm-hmm.
And so that was very empowering to me because I also had my own lived experiences of my own pregnancy journey that I wished others could have been in that same position that I did and have that same outcome. I don't wish others to have preeclampsia, but I wish that the support that I received could be something that everybody could get. But I know that that's not necessarily the real world for everybody. And I encountered a lot of different individuals during my journey too. So I'm passionate about this topic for not only professional issues or professional reasons, but just for my own personal lived experience reasons and just for
Absolutely.
what I've seen in some of my friends and colleagues too. So thank you so much for allowing me to be here. I will do a disclaimer up on the front of this is that just everything that we talk about today is really just my own thoughts and reflections, not that of the institution that I work at.
Mm-hmm.
It's really just having this conversation with you as me, Rachel Tyrone, the clinician and mom who wants everybody to understand maternal mental health and us all to really come on the same playing field and to reduce that stigma. So thank you
Absolutely,
so much for having me,
absolutely.
Lejeune.
Of course, I'm so glad that you're here, and thank you so much also for sharing your lived experience. Over dealing with preeclampsia in your pregnancy. Oh my gosh, there's so much that could be learned from lived experience. Lived experience is such a powerful tool that we can utilize to improve maternal health care outcomes here too in our state, not just here in Mississippi, but nationally as well. So thank you so much for sharing that lived experience with us
Certainly.
tonight. As we navigate and kind of open up the floor to kind of having this conversation, something I always like to do, I'm a stickler for statistics. I know I am. But I do think that statistics help to ground us, ground the conversation, especially conversations like this where can be a little emotionally charged. So one of the statistics I kind of wanted to talk about was one that came from Postpartum Support International, which is a great resource to us all that are in the maternal health space. But they talk about how 1 in 5 women will experience a perinatal mood or anxiety disorder, like depression or anxiety, in pregnancy or in the postpartum period, which is typically that year following the birth of your baby. And so that's a lot of mamas. That's a lot of mamas. Yet so many of us are living in silence. So many of us are unsure of what we're feeling when we're kind of experiencing these emotions. So I was hoping that you can kind of start us off tonight by kind of talking about what are perinatal mood and anxiety disorders, right? Like, what do they encompass? Because I think a lot of people just are taught to look for postpartum depression, but there are so many
Right.
other things that can be going
Right.
on. So I was hoping you can kind of talk to us about that.
Right. So yeah, perinatal mood, anxiety disorders, all those PMADS, those are really just those mental health conditions that can happen from during pregnancy throughout, like you said, that first birth, that first year of birth. It's not, it's oftentimes like you're mentioning, people think it's more of just depression,
Mm-hmm.
postpartum depression, but it's more than just that. It is that depressive aspect of it. It is when we have some anxiety disorders underneath that. And also too, something else is post-traumatic stress disorder. So
Mm-hmm.
what could that possibly be as far as your previous birth experiences or your other lived experiences you're bringing to the table and how that may be impactful. There's also perinatal bipolar disorder too that can fall underneath those PMADs. And then also it's rare, but psychosis is also something that we need to be aware of too. So it's not just postpartum depression. Yes, that deserves its own awareness and bringing attention to it, but it's more than just that.
Sure.
It's the depression piece of it, it's anxiety, it's other aspects that are influencing how we're able to navigate that very precious time in life that we all just need to do a better job of thinking about that and screening those issues as well.
Absolutely. And you know what, Dr. Tyrone, thank you so much for explaining that so clearly. And I'm so glad that we're having this conversation because it's such a timely conversation. You know, ACOG, and for those of us on the call who aren't familiar with ACOG, ACOG is the American College of Obstetrics and Gynecology. They've kind of shared a report talking about how perinatal mood disorders or mental health conditions in pregnancy are one of the leading causes of pregnancy related complications. And they talk about how these mental health conditions can lead to pregnancy related deaths, like things
Hmm.
like suicide and
Right.
substance use disorder. And I think this is such a timely conversation to have because, it's contributing to maternal deaths, unfortunately. And so, if we can raise awareness and educate mamas about some of these things, and that resources are available, treatments are available to kind of help improve outcomes, I think that contributes to, like I said, changing the narrative around this.
Right.
So, yeah, thank you
Right.
so
And even
much.
normalizing it to like what you were mentioning earlier, if 1 in 5 women are walking through this journey, that's a lot of women. And so that's a call for us just to lock arms and really better understand and really just be more open and transparent and more awareness of it so that the stigma is just gone. That's not even a thing anymore.
Yes.
That'd be fantastic.
Yes, stigma is such a real thing to navigate when you're dealing with some of these emotional challenges during pregnancy. Because I think we're conditioned to, oh, motherhood comes naturally. These
Right.
things will kind of pass, and when they don't pass, you're feeling inadequate as a mama, and that goes with attaching that stigma to it. You're scared to say, hey, I'm experiencing this, not knowing that there are other mamas who are also experiencing this and in the same boat as you, just afraid to speak up, afraid to reach out for help, for fear of, guilt, shame, feeling
Right.
inadequate as a mama. Um, all of these things are very, very challenging things to navigate. But again, just normalizing the conversation and knowing you're not alone really can empower us all. Like you said, I love what you said, lock arms. Yes, like we need to lock arms and know we're in this
Yes.
together. So, yeah, thank you so much for that. I love that. I did want us to kind of also talk about risk factors for perinatal um, uh, mood and anxiety disorders because data shows that there are genetic and non-genetic factors that can predispose us or increase our risk for developing a perinatal mood and anxiety disorder. So I was kind of hoping that maybe you can kind of talk with us about those risk factors, genetic and non-genetic, maybe.
Right, right. So, well, things like previous mental health conditions, that's going to be very important. If prior to pregnancy, you may have been experiencing a mental health condition like depression, anxiety, bipolar, whatever it might be, it's not likely to go away during pregnancy. Just because that's a nice, joyous time doesn't mean that the journey that we were on all of a sudden that's different and we're now going to be on the opposite end. So just knowing that we've had a history of mental health concerns or difficulties may also be a risk factor. And then, you have a history of trauma or
Mm-hmm.
even abuse. So we
Mm-hmm.
come to the table with our own previous lived experiences. And depending upon what that looked like, if you were unfortunately exposed to physical abuse, emotional abuse, whatever it might be, that's going to put you in a vulnerable position, and it can be further exasperated by going through this new time of life throughout that perinatal journey. Um, Other things like just hormonal changes, like that's gonna happen.
Mm-hmm.
I remember after my baby was born, again, we had a different journey than what I thought it was gonna be. But I remember after he was born, those first few days, I just could not stop crying. Like I would look at my baby and just cry. And I'm like, why are you
Yes.
crying? And one of the things I was trying to tell myself, like, stop crying. Why are you crying? And then but then I was very like calm and kind to myself and say, hey, these are probably the hormones, but there's just
Hmm.
a normal part of hormone fluctuations that's going to
Yes.
happen during pregnancy, and then especially those first few days postpartum. But that can make you susceptible to mental health issues as well too, whenever
Hmm.
you're thinking about those hormonal aspects of it. And even a complicated pregnancy or birth experience.
Yes.
If this was not the journey, that it's all like what everybody always says, like you have this dream of what your wedding's going to look like. You already have that person already figured out, what you're going to wear and where it's going to be. You had this whole journey figured out. Well, same way with babies. A lot of the times we have a general idea. I know, especially for me, you have an idea of what this whole beautiful 40 weeks of pregnancy is going to look like, zero complications, easy peasy. And then that's not the case. And so when you have that, especially if you're thinking about mothers who've experienced prior losses too,
Yes.
navigating some of those complications and
Yes.
what that can look like for that specific pregnancy that you're carrying at that point in time, all these things can be stressors that can put us at more risk for having a mental health disorder.
Yes.
And
Thank
one
you.
thing you mentioned too, lack of social support. If we don't
Yes.
have,
Huge.
it truly is true when it says it takes a village. Like, it is very difficult to raise a child on your own, and it's very difficult to walk through pregnancy on your own too. Especially if you, again, you go back thinking if you had a complicated pregnancy or even birth. If you didn't have somebody there with you, a partner, a friend, a family member, whoever that might be, if you don't have somebody there with you, it can feel very isolating.
Absolutely.
Um, so that lack of social support is very much so a risk factor. And
Hmm.
even relationships within that, you may have people there, but what is that relationship like? Is
Hmm.
that a stable relationship?
Hmm.
Is that present, or is it unstable? Because then that can further exasperate some of these things. um, and then if you even think about socioeconomic factors, so if we think about financial stress, oh my goodness, I don't know how it is so expensive to have a child
Oh
these
yeah.
days.
Oh yeah.
And so it is expensive to walk through a pregnancy, it's expensive to have a baby. And so if you're living on very little income, you're going to have some additional stress. And a lot of the issue that makes us at risk for these mental health conditions, a lot of them are tied to stress, and
Hmm.
the stress that we just have in our environment and in our relationships, whatever it might be, that's going to compound on whatever we already have underlining. So knowing that the financial income that we have, the ability to have stability in our life, that's so very important when it comes to mental health. And another thing too is if we think about if the pregnancy was a high risk pregnancy,
Hmm.
again, that kind of goes back to that journey that we didn't think that we were necessarily going to have. So
Hmm.
maybe it was even an unplanned pregnancy.
Yeah.
That there may be that might not have been what you were anticipating. That wasn't the journey that you were wanting. And so there can be a lot of different mixed feelings that you can get, that you can have during this time, and these things can make us more at risk for um mental health conditions too. And you mentioned genetic factors. That's very important. We're born with a set of genes, but ultimately at the end of the day, I think we can look at it as there's these genetic issues, and then there's these environmental issues, and the
Yes.
environmental issues are made up of a whole bunch of different aspects. But these two things together can either help facilitate good mental health, or it may add to the challenge that we may already be experiencing there too.
Yes.
um and so yeah, that's, I would say those are some of the risk factors
And
too, as far as mental health.
thank you so much. It could, because you hit on so many very important things. You highlighted a lot of different things that I agree with you wholeheartedly that are super duper important. Yes, if you've had a birthing trauma, if you've had a complicated pregnancy, inadequate support, I think we've done in recent years a better job of recognizing how important partners are. Back in the day, dads kind of sat off to the sideline, weren't really expected to be a part of the process. However, and I think in recent years we've done a good job of just recognizing how important partners being involved in the birthing process and informed of the birth during the birthing process really can help navigate in a positive way the trajectory of a pregnancy and a postpartum period. So I just love that
Right.
we are having more conversations about that. And I love how you also talked about, I've served on a couple of maternal mortality review committees in Mississippi and Louisiana, and one of the things that we see is that pregnancy can, like you mentioned, exacerbate some of these symptoms, right? We might have been doing fine, and then we get pregnant, and then, hormonally things become unbalanced and can kind of contribute.
Right.
And then, not to mention, you named all those other factors that may be at play: socioeconomic instability, lack of transportation, lack of healthcare insurance, like other things that may be going on that are also influencing the pregnancy as well. So yes, I just love us, just bringing awareness to that and having an open conversation about it. And when you were talking about the being genetically predisposed, I was attending a conference, and I think one of the facilitators was just talking about how important it can be to have a plan, like include knowing if
Right.
you have a mental health condition and you are at heightened risk for your symptoms to be exacerbated, or that we want to mitigate risk. We want to not have a full-blown mental health crisis while pregnant in the postpartum period, but having some
Right.
type of plan, incorporating that into your birthing plan some way. Okay, how are we going to navigate this time? We know that, I have ADHD. We know I have autism. We know I have bipolar disorder. Okay, so I'm pregnant. What is our plan? How are we going to navigate going through that? And, I know we're going to talk about a little later, talk about medication, but also, okay, how do we reduce risk to the baby? What's our plan for utilizing medication during the pregnancy and things of that nature? All of these are conversations we should just have with our providers, right? And feel
Right.
comfortable having conversations like this with our provider. But a lot of us don't feel comfortable. So, yeah, it's just really about also mamas feeling informed. When you're
Right.
informed, you feel empowered, and you feel like
Right.
you can go in and ask these questions and kind of open the door to some of these conversations. So, yes
Right.
to all of
Well,
that. I love it.
and that's why I feel it's a for me, it's I can sit where I'm sitting and have had the experience that I've experienced, but that's because I've had this additional training and just awareness in these issues. So when I was pregnant, like I knew what to ask, like, and I knew some of these issues, and so it it puts you in a different perspective. But
Mm-hmm.
knowing like that I'm coming from this place of where I have these things that not everybody has, and I've got this just access to stuff that we all need access to, but we don't. And
Mm-hmm.
so to imagine navigating these issues when you don't have these supports in place, when you don't have these just necessary, just human needs. Like there are these
Yes.
needs that we all equally need, that we just don't all have access to, unfortunately, that
Yes.
are so impactful for our mental health.
Yes, I'm with you 110%. You're right. Like being a provider or working in the maternal health care space, like for us, it can be a given. Like, okay, this is what I need to do. I need to, this. But again, how do we disseminate this information to the public? How
Right.
do we disseminate this information to the mamas who need it? But again, I think creating spaces like this where we're having these conversations is definitely a way to raise awareness and make sure our mamas are informed. So, just another reason why I'm so glad that you're here. So, and we kind of already touched on this. I kind of want us to continue to reflect on the conversations around social determinants, because social determinants of health are a big deal. It's pretty major, especially in Mississippi. Um, you know, for many of us who are not in the maternal healthcare space, it may be a little difficult to make the connection with how social determinants can impact a mama's mental health status. But things like housing instability, limited access to healthcare, You talked about experiencing a trauma. Yes, these are things that can certainly impact the mother's mental health during pregnancy and the postpartum. I mean, the connection is definitely there. I just wanted you to maybe help us, or for some of us who are not in the maternal space who are tuned in, hey y'all, help us to kind of make the connection as to how those social determinants of health um, can increase the vulnerability for a mama experience perinatal mental health challenges.
Right. Yeah, that is a very important component. I guess kind of to back us up to just thinking what social determinants of health are those conditions in which people are born, where we
Mm-hmm.
grow up, where we live, where we play, where we work, just where we live out our life. And so these are issues that we know can impact overall health, and it can exasperate your perinatal health as well too.
Mm-hmm.
So there's different, you already touched on some of the what are some social determinants of health. Depending upon what literature you look at, there's a couple different variables, but some key ones are access to healthcare. So that's very important, right? That's going to be your housing conditions. Those are going to be very important. Your economic stability, that's
Mm-hmm.
really important. We kind of covered a little bit about financial stress there too, but we'll talk about that a little bit more. Your social supports, that's a part of that social determinants of health as well too. And transportation is a big piece of that. So all of these things, if we think about where we work at, where we live at, where we play at, where we live out our life, you can see that that can place individuals at risk for differing health
Yes.
outcomes. And so
Mm-hmm.
say we have a mom who lives in, I don't know, let's say Jackson. Say you live in the right smack dab middle of Jackson, Mississippi, and you have access to a whole bunch of OB clinics. So you're going routinely to your OB appointments because say you maybe you have a job, so you have employment, that's a social determinant of health. Say you have employment, which your employer offers you insurance, so that's access to healthcare insurance, and you're pregnant. So what are you going to do? You're going to use the time that your employer gives you to take off, go to your OB appointment with using the insurance that your employer has, and you're going to go to your routine visits. You're going to drive in the car that you had to that appointment, and you're going to follow up with your doctor. And maybe, let's say, you had a little bit of a high blood pressure reading, but they're going to kind of keep monitoring you closely. So you now have access to better health care because you have your insurance. So all of these pieces are influential in where you're at. So so you have that one mother. So now let's say you have a mom who is in very rural Mississippi. And say that in your county, you do not even have a hospital. So now we're running into a whole other issue of access to healthcare. But now you don't even have health insurance, because the place that you work at does not provide health insurance. And so now you do not have health insurance because your employer does not offer health insurance. And you may not be aware of some of the issues or some of the new legislation that's been coming out that you can get on insurance once you find out that you're pregnant. But maybe you didn't know about that, and so now you find out that you're pregnant, but you're afraid of how much money it's going to cost to go to the doctor
Mm-hmm.
because you don't have health insurance. You also do not have a job in which you can easily take off. Bills have to get paid, so a day off of work is a day that you're not being able to supply food for yourself if you have other family members. And then even thinking about transportation. So I live in a rural place. I have to drive 1 hour to the nearest family medicine clinic. I
Yes.
don't even have access to OB care. And so say that now I'm coming in at 7 months because I have a really bad headache and I've had limited prenatal care up until now. I show up at this clinic, my blood pressure's through the roof. Well, what if that mama could have been taken care of earlier on? What if we would have locked arms with her and taken care of what moms how we should, and she would have always had access to health insurance. She would have always had access to a some form of a maternity care provider. And so that those differences in scenarios is what social determinants of health looks like whenever you do have access to all of these issues and when you don't have access to all of these
Mm-hmm.
issues. But it doesn't even have to be that you live in Jackson and you have access to it. You can be like two people living in the same area having two totally different outcomes with
Yes.
their pregnancy journey just because of some of these issues that are what we consider social determinants of health, that can have very different trajectories on your health outcomes. And so we know, go back to these same two mamas who maybe had high blood pressure issues. One got managed early on, taken care of, everything's fine. One didn't get managed early on, wound up having a preterm delivery and then low birth weight baby. And then so now you have complications for the mom and then also complications for her baby as well too.
Yes. And just thank you too for bringing up those scenarios, and particularly for the rural mama, right? That is a very real reality for a lot of Mississippi
Right.
mamas because we're in a state that is about 46% rural. And I just read an article not too long ago that 70% of our rural hospitals are not equipped to deliver babies. So the
Right.
likelihood that you are having to travel some distance to get back and forth to your OB provider is very likely, if you are a mama expecting in the state of Mississippi. And then all of those challenges that you describe for that mama, yes, that's weighing on your mental health. Like, oh my God, I don't have
Hmm.
transportation. How am I going to get back and forth to my prenatal appointments? And if you do have a complicated pregnancy or you are high risk, having to travel an hour to your appointments or to deliver your baby could be a matter of life and death, unfortunately.
Exactly.
And
Exactly.
talk about stress. Talk
Right.
about
Right.
stress. Um, so I'm so glad that you mentioned those scenarios in terms of just like access to care, living in rural areas, which all present as challenges and all come with some level of anxiety or stress
Hmm.
if you are expecting and you live in an under resourced area.
Exactly.
Yeah.
Exactly. And I even reflect onto my own journey. So at 28 weeks gestation, I was diagnosed with preeclampsia. And so I don't live in Jackson. I work in Jackson, but I live in a rural area. I live in a county in which we have one hospital, and that hospital is not equipped to deliver babies. So it's the
Oh.
same general example, but I mean there's differences obviously because I have a job working at where I work at and I can commute. But there, I remember I was admitted at the hospital and wound up having to spend the next 6 weeks admitted on the L&D, not L&D floor, it was the perinatal or antenatal, that's what we called it, the antenatal floor, where I was able to be with other mothers who had preeclampsia or other mothers who had high risk pregnancy issues, and maybe they're there for observation or whatnot. But I would remember I had sonograms every single day of my sweet baby, and so I would go down there and wait in the area with the other mothers, and I would get to hear their stories. And
Yeah.
so I would hear where um, there was this one mother who, and you would have to know the preeclamptics or the preeclampsia folks who I called us the livers. We lived there for a little while, like we
Yeah.
lived out the rest of our journey there.
Yeah.
Um, when we were living there, I did not have any other children at home. It was just my husband, and I miss you, but like it's okay. I can stay here. But there would be other mothers there who they would have to leave AMA against medical advice because they had competing priorities. We had other family
Mm-hmm.
members at home we had to go and take care of. And so and they're living very far away. And so now you have a mother who has preeclampsia, which is a very deadly, it could turn very deadly very
Mm-hmm.
quickly. And
Mm-hmm.
so there would be moms who would have to make those decisions to leave the hospital where you're being monitored so often to going back home into your rural area where it could take you, like you said, an hour plus to get to the nearest hospital, and that is time that you may not have in the event that you move towards eclampsia. And so knowing that there's decisions people have to make for their life and their life of their unborn child, and it's because the system is not always great for what we need it to be. It's not always there to, we don't have access for all moms if you have preeclampsia that you can be seen near home, so you can be by your families, you can be by your loved ones. So it's hard, like, and that's like you mentioned, it's got to be taxing on your mental health if you're having to make this decision, who do I need to go home and take care of, myself, or I need to go home and take care of my other children, or I have other responsibilities.
Yes. Oh gosh. And that's the reality for so many mamas. And so thank you
Hmm.
so much for just uplifting that. Like, we really have to do something about putting, because when you were talking about that, I was just thinking about similar stories that I've heard from mamas, going back to work before 6 weeks. I'm like, you're going back
Right.
to work 2 weeks postpartum, but like feeling I don't have a choice. I have a card note. I
Right.
have the rent to pay. I got to feed my babies, or I don't have support systems in place to help me with these things. Um, and so it just when you were talking, it just brought back those memories or my conversations with mamas, and you know going back to work before you are physically able to,
Exactly.
again, can further compound complications that you are having, make things worse.
Right.
But like you said, this is the reality of so many mamas. Like, they have these competing responsibilities. Yes, I recognize I am important, but I also have these little people who are dependent on me back at home, and I have these other responsibilities to care for. It's really heartbreaking, but we need
Hmm.
to hear this. We need to hear these perspectives. We need to hear these stories, because this is how we start conversations. This is how we try to introduce policy, or implement programs that can better support mamas who are navigating these really challenging times. So,
Exactly.
oh, thank you so
Exactly.
much for bringing that up, because that was a good one. I appreciate that so much. And I know for me, from a personal and a professional perspective, um, I think I would feel remiss if I just didn't talk, because we're talking about high risk, being high risk, and I feel like this is an appropriate time to kind of maybe briefly kind of talk about how the lived experiences of Black women. I recognize, particularly in the state of Mississippi, Black women are at heightened risk for experiencing pregnancy-related deaths. Unfortunately, we are 3 to 4 times more likely to die from pregnancy-related death. Our babies are, I think Mississippi is unfortunately number one in infant mortality, which is very, very
Hmm.
devastating. And again, I know we're tying that into you know mental health conditions, but a lot of times there's data to show that oftentimes Black women's concerns are dismissed during pregnancy and the
Right.
postpartum. Sometimes their pain is underestimated. Sometimes critical care is delayed when it comes to mental health conditions, or perinatal mood and anxiety disorders in Black women. We know that Black women are at heightened risk for underdiagnosis or mistreatment. And so, again, all of these things kind of contribute to our mistrust of systems,
Right.
and influence our likelihood to seek support, to seek care. And so, again, just being aware of these things, providers being aware of these things, and the importance of providing culturally responsive care, and then also trauma informed care. Trauma informed care is good for
Right.
everybody.
Right. Oh,
Yes.
100%.
Yeah, trauma informed care is good for everybody, but unfortunately, a lot of our providers aren't trained in trauma informed care
Hmm.
or providing culturally responsive care. And so I think that is something also too that we can do, for our providers, our OBGYNs, our nurses, our even our doulas and our midwives and things of that nature. So yes, I definitely wanted to just plug that in there
Right.
as well.
Right.
Yeah.
And I love that you bring that up because like you said, trauma informed care, everybody needs that. That needs to be something on the forefront of all of our just trainings because the way I understand it, the whole goal of trauma informed care is we just don't want to re traumatize what's going on. That doesn't mean we're not
Yes.
asking.
Yes.
That doesn't mean that we're not asking about these things. And in a little while, I'd like to speak a little bit towards some of the long term implications of all of this. But it's just because we don't want to open up that can of worms, we're doing our patients disservice when we don't talk about these things.
Yes.
But
Yes.
the problem is you're not trained in how to talk about these things. And so how can
Mm-hmm.
we as a culture, as your organizational culture, come together and say this is the type of approach we want to have? We want to make sure that we're recognizing everybody's lived experiences And there was one of the best books I've read, and this is not a plug for it. I get zero royalties from it. But What Happened to You?
What
That
happened to you?
from Bruce Perry and Oprah Winfrey. If you are an audiobook listener, I highly encourage the audiobook version because it's both them narrating, and so it's very good. But that is a great book to better understand that it's not what's wrong with you. So mama coming into the clinic and all these things are happening. What's wrong with you? It's what happened to you? What brought you to this journey to today? And so then we're better understanding that all of these risk factors we were already talking about, the bulk of these things are going to be environmental. The bulk of these things that are happening that cause these extra stressors in our lives are going to be things that we could avoid. They
Yes.
are preventable, but unfortunately they happen. And if we can better have these conversations and understand that these are what's driving the bus, these issues,
Hmm.
let's get you back in some, or let's get you in what we know would be evidence-based interventions that will be helpful for that. um and so just thank you for bringing up trauma informed care. So if anybody is on and that they lead an organization or even work in an organization, you work anywhere, just think about bringing up trauma informed practices into your
So important.
center setting, whatever.
Absolutely. So important. What happened to you? I wrote that down. So chat, if anybody book club, I'm
Right,
going to
right.
read this. What happened to you? I've written it down. It's on my to-do list, and I have an Audible subscription, so I may just, I'm going to add that to my Audible subscription. But yeah, trauma informed care is just like it's good for everyone, and if we
Mhm.
follow that, that's another way that we can mitigate and reduce risk, and especially with our mamas. But I'm so glad that you brought up providers, because a lot of times, like you said, well, a lot of times providers are scared to ask these questions because it's like, well, I don't have any resources for you. So if I open up
Right,
this door,
right,
I don't have anything. Like I don't have no one to connect you with. I don't know how to connect you with resources. But again, helping the providers to feel empowered and knowing who to contact, right? So maybe
right,
you don't know, your clinic does not have access to the resources or important information, but helping you to feel empowered to know where to go can be a really important first step. And shameless plug for the maternal mental health hotline, by the way.
right.
I try to plug them wherever I go, wherever I speak. They are a really great resource for providers. And I believe, if I'm not mistaken, for those providers we got on the call, you can go to SAMHSA's website. They have some, I didn't know I was going to, well, they have little nice what are they called, magnets that you put on your refrigerator, and it
Yeah.
has the maternal health
Hmm.
hotline. They'll send you a huge box
Hmm.
of those for free. You can give those to your mamas, and so they know, okay, if you're experiencing a very difficult time or you don't know who to speak to, you have folks who are trained to talk to mothers who are expecting or in the postpartum period. So it's a 24-hour hotline. It's amazing. From my understanding, the first couple of years, I think it launched in 2022, and it's been well received and greatly just a great resource for our mamas. So
Right,
the maternal mental
right.
health hotline is amazing.
Right.
But yeah,
Well, on that same,
yeah.
if we're gonna do shameless
Go ahead, go
plugs,
ahead. Let's do
so
it.
that is a beautiful resource for moms, and also taking it back to providers. It's you don't want to open up, like you said, that door unless you know what you can do with it. And so there is a great program that we have here at UMC. Again, shameless plug because I help work on that grant. But it's called Champ for Moms. Champ stands for Child Health. Wait, no. I'm gonna butcher it, so just do Chant for Moms. I don't
Champ for
wanna do my
moms.
colleagues a disservice, and getting all the acronym, but Chant for Moms, I believe .org or .com, but if you just type in Chant for Moms Mississippi, it's gonna pull up. That is where providers, maternity care providers of any capacity, you work with moms in any manner, whether you're a prescriber or you are a partner walking with them through that journey, not a actual partner, but like you are a clinical provider walking the journey with them. You can call Chant for Moms and they can give you access. They have a repository of resources. And so you can say, hey, I live in Lawrence County, Mississippi. I have a mom with X, Y, and Z. What are some resources nearby? And they can give you those resources. So you really providers now have access to be able to give moms what they need. So they have questions, concerns. Here you go, mom. I'm calling this line. I'll call you right back with a good resource near you. So
That
shameless
is
plug, Champ for Moms.
amazing. Yes.
They have some great resources and can help with that for providers
Yes.
across the state.
Absolutely. And I know some really good providers, professionals over there at Champ for Moms, some really good professionals informed. So yes, I second great resource for sure. Um, earlier we talked about, and it kind of ties into our conversation surrounding providers, but one of the leading pathways that we have for prevention is centered around screening. And you mentioned screening a
Right.
little bit earlier. I wanted us, before we close up, this will probably be our second to last question before we open the floor to comments and questions. But I wanted you to maybe touch on screening a little bit and why it's so important and what are the screening tools that are currently available to kind of assess for PMADS.
Right. So, screening is so incredibly important. That is going to be your frontline defense on prevention, or at least intervening early. And just like what we know in early childhood, early intervention, and not just like the service, but the whole concept of early intervention is so impactful. It's the same way with maternal mental health. If we can intervene early, identify that there is some differences in our mental health earlier on, then we're more likely to have better successful outcomes
Yes.
later on. So if we can screen for things like depression, anxiety, OCD, and even PTSD, then we can see where individuals are then getting plugged into timely services that they might need. And if we have screening as part of just our routine clinical practice, then that might let the mom, the providers, everybody's aware that this is something that we're doing. Screening is just a foundational part of our just appointment. And so therefore this is not because of we think you're at risk. We're assuming that everybody can
Mm-hmm.
have be at risk for this. So we're just
Mm-hmm.
going to screen everybody for these issues. Because we know that there's long-term implications if we don't screen. If we do not screen early on, then we miss these opportunities for intervention,
Yes.
and then we miss these opportunities for really the development of that child as well too.
Yes.
Um, so it not only just promotes just better health for moms, just moms feeling more supported, moms knowing like I remember I have several friends who have walked through pregnancy and they would just say, I know it's not the correct term, but when you're not in this mental health space, they don't know. But she'd say, I just felt crazy. Like I don't know how I just don't know what I'm feeling. And I'm like,
Mm-hmm.
we all feel that way. We
Yes.
just don't know have a better term for that. We're struggling through this new journey, but we need to normalize that. And so
Yes.
if we can do a better job of screening and talking about that, then we can maybe reduce those stigmas and have just do a better job of just discussing these things. So there's a couple different types of screening tools. Again, I'm not as day in and day out with the screening tools, but the Edinburgh is
Mm-hmm.
one type of postpartum depression scale that can be used. There is also it's the PAD, right? Or it's the
PHQ-9. Yep, that's
PHQ-9,
one.
that's it.
Uh-huh.
Those, the PHQ-9. And so those are very routinely
Oh yes.
used.
Yes.
I do remember though, whenever we were going to one place for my baby, because there who is supposed to be screening for these? That's a whole other door to open up. Is who should be screening for PMADS. But when I was at my son's like second appointment, like once we were discharged from the hospital, and you're just your regular, you go and see your pediatric provider. I remember just they asked me just blankly, "Are you depressed?" And that was all they said. I'm like, "Well, where's my screener? Like,
Right.
where is my?" Because then that's when we left the clinic. But I was like, where is my screening tool? Because if they weren't screening me, knowing the history of preeclampsia, knowing the history of premature birth, so if you're not screening me with my
Mm-hmm.
just coming in these conditions, I don't know if you're going to be doing developmental screens on my baby. So we wind up leaving, but those are so easy to do too. They're
Yes.
so easy to
Yes.
access. And one thing that I did hear somebody, and if there's any providers on the call, one thing that I heard was so influential to me, it's let's ask permission to also administer these screenings. Like
Mm.
let's ask permission that we can look into these issues. So
Mm-hmm.
having that conversation around just opening up and allowing there to be this back and forth accountability is not a good word, but this back and forth participation in your care.
Sure.
So,
Yes.
those are two really good ones. There's others out there, but those are ones that are used pretty
Absolutely.
regularly.
Yes. I love this conversation. I love us like just because a lot of like I it's not a it's unfortunate that we know and ACOG recommends like we should be screening in the during pregnancy at least once in the pregnancy and once in the postpartum period, and some organizations feel like it needs to even be more frequently than that, like we should be assessing even more frequently than that. But yes, this is how we identify if there are issues that we need to further explore or talk to our mamas about. And so yes, I love everything about that conversation. And like you said, these tools for screening are so easily accessible. If you just want to look at one, you can Google search and you can download them for
Right.
free off the internet and
Right.
everything, y'all. So
Right.
very, very accessible. As we kind of wrap things up, I know we got a little bit more time to open the floor up to look at the comments and to let y'all ask some questions. One of the things I kind of wanted to talk about was, what are ways that because I think, supporting mamas should not just be something, it shouldn't be an afterthought, like for us. It shouldn't be something that
Right.
we think about when we're pregnant or expecting. Like, the health of a mother should definitely be something that we're all concerned about. We all should be wanting to see our mamas thrive during their pregnancy and the postpartum period. And so, something I kind of wanted to, wrap up and kind of talk about was, how, in what ways can we better support our mamas, and in what ways can we better empower them um, as well. So, I was hoping you could maybe kind of touch on that a little bit.
Yeah, so some things just kind of reflecting on that would just really offer just emotional support and validation. So just that's one big thing, just validating that
Mm-hmm.
this is a valid concern that you have. We're not just going to dismiss you because you just had a baby, but really validating and normalizing some of these feelings, so then we don't all feel like, okay, well, there's something wrong with me. Like I'm doing something wrong and I'm wrong for my baby. So really just listening to moms,
Yes.
listening without judgment. Like we're not ready to judge. We're
Huge.
just actually
Huge.
listening,
Mm-hmm.
and acknowledging their experiences. Those are going to be very important things. And then if we're even just thinking about support broadly, like if we're thinking about family support, partner support, if we have anybody on the call who's close to having, or the call, we know you're a part of Zoom whenever, or the WebEx time when you talk about calls, but anybody that's on a part of this just conversation, if you know of anybody soon to have a baby, thinking about how can we practically just help the caregiver? How can we, if it takes a village. So instead of coming in and visiting that newborn mother and her newborn baby and taking the baby from the mother, why don't you just stop and ask, like, what can we do to help you? What are some practical tasks that we can do to help the family members with this new adjusting? And then encouraging self-care too. Like if they need a second to take a nap or just
Yes.
to do something for themselves, not feeling like, okay, I'm a terrible mom because I just let my baby go to grandmother's house so I could take a nap. Like, how can we normalize self-care, but also having some of those practical assistance around the house too? And even just offering professional support when needed. Like I think we can all benefit from having a therapist walk alongside of us in our journey. And so that perinatal period is nothing different too. So how can we make sure we have access to, and that's why I love that you gave Postpartum Support International, because they have great resources and a lot of great resources that if you want to talk to somebody, you can.
Mm-hmm.
And so normalizing that it's okay to talk to somebody. There are great professionals like yourself, Lejeune, who are just wonderful clinicians that just want to walk alongside of you in this journey. Um, Educating ourselves, like how can we educate each other on
Mm-hmm.
the importance of perinatal mental health,
Mm-hmm.
understanding what the signs are, and again, listening and acknowledging it without fear of just judgment of what might be
Yes.
going on. And then creating just safe and supportive environments. How can we better create these supportive environments that can foster the I like to call them newborn parents, because we are, it's just
Yes.
like a newborn deer. You have no idea what
Uh-huh.
you're doing. That child has no idea what they're doing, neither do we. And when we
Yeah.
left the NICU, I asked them, are you sure I can take this baby on with me?
Oh.
So how can we create a supportive environment for new parents walking through this journey together. And there's so
Absolutely.
many other pieces of what we could do too, but there's even thinking about policies for how we look at that family unit.
Mm-hmm.
Because if we're interested in taking care of kids, we have to be interested in taking care of families because they're all two together, and
Yep.
especially moms. Moms are so important. All caregivers are very important, but we know the research shows us time and time again how important mom's mental health is and the success of her children too. And so
Yes.
we just desperately need to make sure we're always keeping mamas on the forefront, always thinking about the family, the whole family,
Yes.
from womb to tomb, thinking about
There you
everybody
go.
and how important they are in this journey too. So those are just a couple,
I
um,
love it.
I guess,
I
things that
love
I would
it.
reflect on.
Yes, and those are all like such great nuggets, powerful. Thank you so much for those beautiful insights. I agree with all of that. You hit on all of that. Self care. Oh my gosh, we can never underestimate. And then the thing is, as mamas, we are the number one, like the worst with self care.
Right,
Like we
right.
count ourselves dead last. But honestly, like I always go back to this analogy: we can't pour from an empty cup. We have to take
Yes,
care of ourselves
yes,
first. And I know that is
yes.
so backwards in our thinking because you're always thinking about taking care of everybody else first. But if we don't take care of ourselves first, we have nothing to offer to take care of the others.
Right,
So,
right.
yes, I just wanted to uplift that up and just, yes. And the practical assistance, yes. Yes, yes, yes. Practical assistance is so important. Just helping with the little things for our mamas that are, navigating motherhood.
Hmm.
It's
Right.
totally,
Because you
totally
have
huge.
stress, like it's so stressful navigating this new journey, and then now I got to go home. And the home still homes, like we still got dishes, we still got clothes to
Yes.
wash. And
Oh,
so there's
yes.
still things that have to happen. And so if we can just help caregivers out navigating that, think about what that can do to that caregiver's mental health
Oh,
and how
yes.
helpful that can be.
Huge. It's so small, so simple. It sounds so simple, but it's
Hmm.
huge, right?
Right,
If you're a mom and you've
right,
been there, you know it's huge. It's
right.
huge. It's a great support. And oh my gosh, we're talking about supports. Our friend of Therapy Plus, Corey Gustavus, is in the chat. He's going to be dropping some local and national resources for mamas. So y'all feel free to share. We got some great maternal or mama centric organizations like the Mommy Organization, like Six Dimensions.
Yes.
Oh gosh, there's so
Mommy.
many. Magnolia Medical Foundation, the Delta Diaper Bank. So many really wonderful resources that are mommy centric that offer supportive networks and services to help support and uplift mamas. So we're going to be dropping those resources in the chat. So be sure to like their pages or go visit their websites. I'm going to navigate because I know we don't have much time. I'm going to navigate over to look at our comments. Let's see what we got here. Tiffany Regan just talked about how life adjustment support systems or lack thereof, having a complicated relationship. I'm assuming that's talking about how those risk factors can influence perinatal mood and anxiety disorders. Kashana Watts, a friend of Therapy Plus, she's also a wonderful doula. She
Oh,
just highlighted,
yay.
yeah, we love Kashana. She just highlighted us as well. Let's see here. Let's see. Okay, Tiffany Regan again, just talking about the importance of screening, early intervention. Oh gosh, postpartum period is so huge. I feel like we
Yep.
forget about postpartum. It's like after that 6 week visit, it's like see you next
Bye.
year, and
Because you
it's
don't
like
see your OPS.
like yeah, it's just like and we know that women are at heightened risk too for
Right,
complications in the postpartum period as well. So this should not be a forgotten time. Like we really
right,
should be doing more to follow up and check in and all of those things. And so
right.
those are just some of the comments that we received. Thank y'all so much for tuning in. This has been such an enriched conversation. Like this has been fun. I have really enjoyed this conversation with Dr. Tyrone today. Dr. Tyrone, thank you so much for
Thank you,
just being
Lejeune. Thank
here and
you.
talking to us. And I just know that this conversation, whether you're watching it live or you're going to catch it on the replay, is going to help somebody. And again, this is just about normalizing these conversations, giving folks information. And I'm so appreciative of you for checking in with us today.
Well, thank you all. This has been great. And if there's any parting words to say for this, it's just let's just walk together in this
Yes.
journey. Let's
Yes.
just do this together. Moms supporting other moms, caregivers supporting other caregivers, because this journey is hard. Life is hard. So there's no need to belittle ourselves. Let's do this together, just walking together. And that I've been fortunate to have that support group. I realize people don't always have that, but I think we can get back to that. I think we can all realize we're in this together. We're not
Yes.
against each other. We're together. So thank you so much, Lejeune. This has been
Of course.
fantastic. I just appreciate all your viewers. And again, thank you for letting me come and
Of
join.
course, we appreciate you so much. And like you said, no, none of us can do this alone, and none of us can
Mm-mm.
change the narrative alone. It's going to take us walking together. So thank you for that. And on that note, thank y'all so much for tuning in. We will see you next time. Bye.
Bye.